Hey guys, what's up? It's me, Clara. I'm here to talk to you today about cystic fibrosis. That's right, TBT to POEM. Cystic fibrosis is an autosomal recessive condition affecting 1 out of 500 Caucasians. Roughly that little nugget right there. That's about 38,000 Americans, which is about the total number of students at UGA. Go Dogs!
Hey look, here's an epithelial cell. There's the nucleus with DNA inside, the rough endoplasmic reticulum, the mitochondria, the apical and basal surface, and some intracellular ions. The CFTR gene on chromosome 7 encodes an ATP-gated chloride channel that secretes chloride in the lungs and GI tract and resorbs chloride in sweat glands. Here is the CFTR gene being transcribed in the nucleus and translated into a protein, then moving through the Golgi to be processed and folded into a functional receptor. In the lungs, a functional channel sits on the apical membrane and allows for chloride to exit the cell and go into the mucus that exists in the bronchial tree. As chloride moves out of the cell, it pulls water along with it. This makes a good watery mucus. Cystic fibrosis is a disease that results from this chloride channel being defective. Many different mutations in the CFTR gene can lead to this defective channel. These mutations are divided into 5 classes. Each class describes a different place in the pathway where something can go wrong. In Class 1 mutations, CFTR is mutated so that there is no protein synthesis at all. This mutation happens in 12% of people with cystic fibrosis. No protein synthesis means no functional chloride channel, resulting in thick mucus that is hard to clear. The Class 2 mutation is called the F508 deletion. The CFTR gene encodes the protein, but the protein is misfolded so that it doesn't get to the apical membrane. Thick mucus again. Yikes! It is the most common type of mutation and is seen in about 87% of cystic fibrosis patients. Wow, that's a lot! The Class 3 mutation is called the G551D mutation. This is the mutation where the receptor can make it to the apical membrane, but it has a faulty receptor that remains closed most of the time. Oh no! The chloride can't get out and the patient still has thick mucus. This is where the drug Ivacaftor comes in. This drug enters the cell and helps the chloride channel stay open for longer. Chloride can leave, enter the mucus, and pull water with it. Look, good watery mucus again. Gosh, this drug's amazing. But wait, Ivacaftor can only open the defective chloride channel in the membrane. So for right now, it only helps the people with the Class 3 mutation. Stay tuned for new developments.
Cystic fibrosis affects a variety of organs throughout the body. The lungs are the most affected organ by CF, but many other systems are affected as well. The intestines. Cystic fibrosis patients have difficulty absorbing nutrients because of a lack of digestive enzymes from the pancreas. This malabsorption leads to malnutrition and poor growth and development because of the insufficient caloric intake. In addition, CF patients are at a higher risk for constipation, intussusception, and can develop distal intestinal obstruction syndrome when thickened feces cause intestinal blockage. Liver. The thick secretions of cystic fibrosis patients can also affect the liver. Bile secreted by the liver can block the bile ducts. Over time, this leads to scarring and cirrhosis, with a resulting decline in liver function. Liver disease is the 3rd most common cause of death associated with CF. The pancreas is affected as well. The thickened pancreatic secretions have difficulty secreting into the duodenum in CF patients, resulting in the aforementioned malabsorption. Pancreatitis can result as well. In addition, pancreatic islet cells can be lost, leading to unique cystic fibrosis-related diabetes. Infertility can result in both men and women. Over 90% of men with cystic fibrosis are infertile due to a congenital absence of the vas deferens. About 20% of women with CF have problems with fertility because of thickened cervical mucus or malnutrition related to the disease. Mucus buildup clogs the airway and causes decreased mucociliary clearance, resulting in inflammation and infection, with a resulting injury and structural change to the lung. Early in the disease, there will be coughing, excess phlegm production, and a decreased ability to exercise. Later, there is a chronic pneumonia and further difficulties breathing. chronic hypoxia and pulmonary hypertension can result, as well as more and more lung infections. Cardiorespiratory complications are the most common cause of death in cystic fibrosis.
Currently, there is no cure for cystic fibrosis, and therapies are directed towards managing symptoms. Inhaled bronchodilators, such as albuterol, can be used in patients who demonstrate an increase in FEV1 of 12% in response to treatment. Inhaled recombinant human deoxyribonuclease, such as Dornase alpha, cleaves extracellular DNA in the sputum, which decreases the sputum viscosity. This improves FEV1 and reduces the risk of infections in CF patients. Mechanical interventions, like this vest, can also help to clear lower airway secretions. Despite all of these interventions, the average life expectancy for those with cystic fibrosis is still in the fourth decade.
A lot of things happened in 1998, like the release of Windows 98, Pokemon Red and Blue, A Bug's Life, me as a 7-year-old, and whoa! Vertex Pharmaceuticals started working on the development of a new drug for cystic fibrosis. It took a lot of time and money and more time and lots more money. Then finally, in 2012, the FDA approved Ivacaftor, the first drug that treats the underlying cause of cystic fibrosis and not just the symptoms.
Alright, let's recap before moving ahead. At this point in time, we've each eaten about a pound of chocolate, a bag of both Skittles and Pull and Peel Twizzlers, some Airhead Sour Belts, and a regrettable number of Jujubes which have now taken the place of 4 teeth. How effective is Ivacaftor at preventing the ensuing tummy ache? I just don't know. But fortunately, for a subset of CF patients with class 3 mutations, it provides improvements beyond that of current conventional therapies. In particular, after 2 weeks of daily treatment, patients with the G551D variant experience a 10% improvement in forced expiratory volume in 1 second, which is a measure of lung function known to deteriorate throughout the disease. These patients also encounter fewer health-related complications and healthy weight gain, which helps correct the weight loss commonly seen in patients from classes 1 through 3. Furthermore, Ivacaftor cuts sweat chloride in half, indicating improved CFTR function. Since being approved to treat class 3 patients, Ivacaftor has shown some promise as a combination therapy for treating class 2 patients, which account for the majority of the CF population. Together with Lumacaftor, Ivacaftor shows a slight improvement in FEV1, and patients encounter fewer health-related complications. Chris, bring us home.
All right, it's business time. As previously mentioned, there was a huge time and financial investment that went into the research and development of Ivacaftor. While the typical treatment of cystic fibrosis normally costs $30,000 per year, Ivacaftor costs over $300,000 a year, making it one of the most expensive drugs available today. And almost as much as the cost of medical school. Yikes. Ivacaftor was initially only approved for class 3 cystic fibrosis patients with the G551D mutation. However, other CFTR mutations within this class of CF have also been added over time. Additionally, in July 2015, Ivacaftor was approved by the FDA to be prescribed as combination therapy with Lumacaftor for patients with the class 2 homozygous F508 deletion mutation. Remember, class 2 mutations results in a misfolded protein that doesn't reach the cell membrane. Lumacaftor and Ivacaftor combo treatment helps chaperone the protein to the membrane and then potentiates channel opening. Looking forward, there are several other ongoing trials testing Ivacaftor efficacy in CF patients from other classes, so there is a potential that this new drug may expand its utility to a larger pool of patients with CF. In evaluating the cost-effectiveness of Ivacaftor relative to other pharmaceuticals, a metric that is often used is the cost per quality-adjusted life year, or QALY. The current benchmark goal is less than $50,000 per QALY for assessing the value of medical interventions. Ivacaftor's value is $1 million per QALY. Just for reference, other commonly used medications and their cost-effectiveness values are statins at $20,000, insulin at $13,000, and the flu vaccine at $5,000 per QALY.